As a general dentist, every time that I pull a tooth, there's a possibility that the patient's gonna have a dry socket. Every time that I do a filling, there's a possibility that that patient's gonna have sensitivity. That's just the cost of being a general dentist. Sometimes things don't work out. It's out of our control. But what about the new patient experience? What about that particular component of our practice process that we're in total control over? We have that control, and all of us as general dentists, we have an obligation to make that a wow experience for our patients. So imagine a new patient comes in, and instead of somebody just handing them a clipboard and asking for an insurance card, how about they walk in and they're completely wowed? The person behind the desk stands up, makes eye contact. They used to shake hands, but in 2022, maybe we don't do that as much anymore, and that person calls them by name. Stand up, make eye contact, call them by name, and then compliment them, somehow. Tell them you like their shoes. Tell them you like the earrings. It doesn't matter, but the patient is complimented. And then, instead of your front desk team member staying behind the counter, behind the desk, that individual gets up, walks around into the reception domain, and sits down next to the patient to go over paperwork, offer water, offer coffee, introduce team members. That's a wow experience. And then really get to know the patient. I don't know how good a general dentist I am. I think I'm pretty good. But I know that my new patient experience is extraordinary. And what I want to do today is share with you how you can make your new patient experience extraordinary as well. So, after our front desk team has completely wowed that new patient, it's time for us, the clinical people, to sit down and do the same. And one thing that I have found to be incredibly effective at creating an emotional connection between myself and the patient is to utilize photography. Good photography, consistent photography. Photography in which the patient, while they're sitting there and looking at me, they're also looking at their dental situation. So what I do in my office, because I'm not a cosmetic dental office, I'm a bread and butter dental office, is we keep it really simple. We take 2 extraoral photos on every single new patient, every single emergency, and the majority of our recall patients. Just these 2, a simple smile and a retracted smile. And then we take our intraoral camera and we kind of do a little tour, maybe lasts 30 to 45 seconds, in which we can take a shot of something interesting, like maybe a broken amalgam or crack or something like that. And then we start that interview. Now, earlier I talked about consistency. The fact is, when I had a super awesome SLR camera, I loved it. It took great photos, but it was inconsistent because it was complicated. Make sure that whatever you use for taking photos is simple. It's something that you can grab with bloody or spitty hands and you can wipe afterwards. Make sure that even the worst photographer in your office can point, click, and shoot in a well-focused, easy, beautiful photograph. And these products that you see on the screen there, they're the best ones. The iCam is the easiest to implement, and the iSpecial is the easiest for the worst person in my office to take high-quality, beautiful photos. So, now the photos are in front of the patient. They're sitting on a screen and the patient's staring at them. Put these photos in front of your patient and then start talking about their teeth. So tell me, on a scale of 1 to 10, how would you rate your teeth? I'm amazed at how many people with beautiful teeth say an 8. How could they have an 8? Their teeth are beautiful. And so my follow-up question is, why would you give them an 8? Why not a 10? And that's when they start sharing with me an emotional connection between their smile, themselves, and then me as their potential provider. I asked them, if there's one thing you could change about your smile, what would it be? And then I continue asking questions without talking to them about what our office offers. I don't talk about whitening. I don't talk about crowns or veneers. I just ask, describe the ideal situation in your opinion. And if we were able to do that, why would it be important? How would you feel if we could fix this for you? These are all open-ended questions, questions that are designed to elicit an emotional response. And then we ask, how would you like to get started? And the one question that I love to ask, especially for patients who are reluctant about getting started, is what do you think will happen if we do nothing. Now we got that emotional connection. We've wowed the new patient. It's great. Now it's time to talk about the handoff. Because when I visit offices, this is probably the thing that gets messed up the most. So the person answering the phone does a great job. They need to hand that patient off to the first clinical contact, whether it's the hygienist, the assistant, or me. And so they need to write good notes into our practice management software. Then that first clinical contact has to hand it off to the dentist. That whatever interview happened, that person needs to hand off that information to the dentist. And now here's the arrow, the handoff that gets neglected the most. I recommend some implants and a crown and some periodontal therapy, and then I walk away. I blow this handoff. That's the one between the dentist and the financial coordinator. And that might be the most important one. That's where you, as a dentist, after wowing the patient, getting to know them, eliciting an emotional response, have the opportunity to explain to your financial coordinator exactly what you have planned, how long it's going to take, and what the patient's most important objectives are. And this gets forgotten in a lot of offices. So here's what I'd like you to do. Remember a quote from the late Peter Dawson. In every interaction with your patient, make them eye to eye, knee to knee, and heart to heart. Now here I am discussing some treatment with my patient, and now here I am introducing that patient to our financial coordinator. Eye to eye, knee to knee, and heart to heart. I hope you enjoyed this presentation, and remember, if you want any more information, you can always visit my website, Be Better Seminars, in which all of the handouts are for free and downloadable. Thanks a lot, everyone.